Good morning, friends. A lot of people ask me what SAAOL does. What education do you do for the heart patients? Give me all the details of your treatment. See, we ask people to avoid bypass surgery, angioplasty, as well as we have to make sure that they don't get a heart attack. You must remember the heart disease, if it grows, the blockages, if they grow, they one day lead to a heart attack. So we cannot grow the blockage. In fact, we want to reverse the blockage. Now, to reverse the blockage, what all we can do where we do not need a surgery or angioplasty? For that, we have 4 treatments. Number 1 treatment is we have to work on lifestyle. That means we have to eat 0 oil cooking. We have to give up all the non-vegetarian food. We have to cut down the fat in the milk. That is, you have to use double-toned or skimmed milk. And lastly, you have to cut down all the nuts. These will cut down all the fat intake. Plus, obviously, we want you to walk every day 35 minutes, plus do yoga and meditation. Along with that, you have to leave smoking and all that. That is the part 1, that is on the lifestyle part of it. Now, my next treatment is on allopathic medication. Suppose you have to control all the factors of the heart disease. Now, high blood pressure, sugar, cholesterol, triglyceride, these can be controlled with medicines also. So on the first day of the treatment, we reduce these 4 so that the patient does not have a risk of heart attack. So allopathic medical cover is number 2. We also give them blood thinner and anti-anginal medicines. Now, these 2 will carry on for a long time. Then we have 2 short-term treatments. One is called the natural bypass, where we using a ECP machine, we open so many extra tubes in the heart. You must know we have 2 kidneys, one is extra. In the heart also there is an extra set of tube that God has given. That extra set of tube is called capillaries and collaterals. If you can open them, then you do not need a surgery. It's a replacement of surgery. It is called natural bypass. Nature has already given bypass in our heart, and that can be opened with a machine where patient does not have to run. He has to just lie down and the machine will squeeze the leg muscles and give you the running effect. And so much of extra tubes will open. 40 days treatment is required for this. And that can be done in any of our 110 centers across India and the world. The 4th treatment is called the detox treatment. Here there is a detoxification medicine that is approved by the medical science, is given to the patient in the form of intravenous drip, or oral is also available. This has a function of cleaning the crust over the membrane which guards the blockage. And once the membrane is cleaned, it becomes more permeable. And if the cholesterol is very low in the blood, triglyceride is low, it will pick up the cholesterol from there and it will reduce the blockage. We have seen so many people reducing blockage in lakhs. We have treated about 5 lakh patients with 98% success. So remember, it's a very safe treatment and we have saved so many people from bypass surgery, angioplasty and heart attack. So SAAOL has become a very famous name all across the country. And even if you do not do the natural bypass or detox, which is little costly, you can at least do the lifestyle change and medical management, which will save you from a future heart attack. So this is what I have to say, and I want you to spread this message all across your friends and your family so that they can also save themselves from a heart attack. Thank you so much. We'll see you. And we have a backup organization called Punyya Life Foundation, which is an NGO. The aim is to educate everybody on heart care. And everybody means every village and every block of every village where we want to educate heart patients. It's a big attempt on our part. Be a part of Punyya Life Foundation if you want. Become our volunteer. Thank you so much.